one of the oldest books about herbal medicine, called the Shennon Bensao Jing. That book was written in a method where you have superior, middle, and inferior things. So it starts with, jades and gemstones, stones, and then it goes into herbs, and it talks about flowers, it talks about vegetables, and it talks about, other things, and it kind of is in order of that, in that way. And then within each category, it's ordered from superior, middle, and inferior. And what that kind of means is that the most superior thing will be the highest therapeutic value with the least amount of toxicity. And then it kind of goes down from there. So, somewhat therapeutic, somewhat toxic, down to a little bit therapeutic, very toxic. In the top category, so the top herb, so the one with the highest therapeutics, the least amount of toxins, it's ordered in. The first herb in that category is Lingzhi, or like the Ganoderma mushroom, so the Reishi mushroom people might be familiar with. So that is the superior of the superior. And this was written by Taoists, so they really talked about longevity. So it says in the text, protracted taking will make one an immortal. So that's a pretty stiff, pretty good statement to say, yes, it's pretty good for you.
Hey everyone, welcome back to the Chinese Medicine Podcast. I'm here with Dr. Simon Feeney, a Chinese medicine physician and an expert in the manufacturing and the sourcing of Chinese herbs. We're going to have a chat today about mushrooms, like the superfood mushrooms that everyone wants to know about. I've had lots of people ask me about this on my channel, and I said I would have someone on to talk about it to answer you. Otherwise, I'll just be making it up. So Simon's going to help us discover the healing power of these ancient kind of things that have been around in our culture for a long, long time. And they're, a superfood that we can kind of use to, help our everyday life. And so welcome so much, Simon.
Awesome. Thanks so much for having me, Mary. I really, really appreciate it. I've been, following with great interest your podcast. I think you're doing a great job to communicate to people in the community about the benefits of Chinese medicine. So congratulations, you're doing a really great job.
Oh, thank you. I just like talking. People seem to like listening.
Well, I've always enjoyed our conversations, so over the many years. So yeah.
It's so good. And one of your newest products that you make is a mushroom brand of products. That's why I thought I'd have you on to talk about your expertise in like the different types of mushrooms that there are. Where do these things come from originally? Like how should people choose what they, or how might they go about choosing which ones they might take? And just your expertise in the quality of those things, and there being so many different products on the market. I think you're one of the people that I know that's I think you're out of all the companies that I'm aware of. This is just my personal opinion, but I think you've got the highest commitment to being ethical and being honest and true to the environment and true to the medicine. It's such a great thing that you do.
Thank you so much. Yeah, we take it pretty seriously. We are the first and only organic supplier of organic herbs in Australia for Chinese medicine. Obviously, more other organic herbs in Australia, but yeah, we focus on Chinese herbs. So we were able to do that. Set up a testing policy to make sure that our herbs were pesticide free. We test for heavy metals, mold, yeasts, salmonella, all the nasty things that you don't want in your health supplements or herbal medicine. So yeah, we're very passionate about that as well. We figure at least if you can have less pesticides in herbs, there's going to be less use. There's less than they're getting into the water. They're getting it in the air, and it's going to be a better planet in the long run from that perspective as well. So it's kind of a global thing that we kind of try to impart like a sense of sustainability throughout the business from a global perspective. It's very important from us.
Yeah, well, it shows through in everything that you do. Like, it's really obvious, and it's really great that you're setting a good example for other people and other practitioners, other companies, I guess, as well. Like, it's good. And I mean, my patients love those herbs. Like, they love the idea that they that they can just be rest assured that they're tested and they're not there's nothing else in them strange in them. And it's just fantastic for Chinese medicine to have organic herbs available, because you're right, there are so many other herbs that are organic that are in the naturopath areas, but for Chinese medicine we've never had that before, and it's awesome.
No, we haven't. Yeah, which is the reason that I started the business. I just wanted to make sure that those were available to my patients, to my family, to myself, and and then largely just grew into international community, which is awesome. And I've got a lot of support from people around the world, which is really awesome. People like that have been doing this for a number of years in America. Like Andy Ellis is absolutely been pioneering this, so we've worked really closely with him. And so it's been a very, very great learning experience for me as well to bring it to Australia. So very happy.
Yeah, that's great. It's so good. So let's answer some questions about the mushrooms, if that's all right.
Yeah,
because I do have a lot of subscriber questions about these things.
Yeah.
So one of the questions that I commonly get asked, just in general, is should I take them? Like, is that something that I need, or something that should people, when should people try to have them, or should they even use them?
Yeah, absolutely. I mean, medicinal mushrooms have been around since the beginning of herbal medicine. So in the oldest text that we have written about herbal medicine on the planet, not just Chinese medicine, just one of them happens to be Chinese medicine. So one of the oldest books about herbal medicine called the Shenong that book was written in a method where you have superior, middle, and inferior things. So it starts with, jades and gemstones, stones, and then it goes into herbs, and it talks about flowers, it talks about vegetables, and it talks about, other things, and it kind of is in order of that, in that way. What is and then within each category, it's ordered from superior, middle, and inferior. And what that kind of means is that the most superior thing will be the highest therapeutic value with the least amount of toxicity. And then it kind of goes down from there. So, somewhat therapeutic, somewhat toxic, down to a little bit therapeutic, very toxic. So, and then everything in between those variations, right? So that's how he ordered how Tao Hongqing ordered organized that literature. And then, and also Shenong really, but yeah, so then in the top category, so the top herb, so the one with the highest therapeutics, the least amount of toxins, it's ordered in the first herb in that category is Lingzhi, or like the Ganoderma mushroom. So the Reishi mushroom people might be familiar with. So that is the superior of the superior. And this was written by Taoists. So they really talked about longevity. So it says in the text, one protracted taking will make one an immortal. So that's a pretty stiff, pretty good statement to say, yes, it's pretty good for you. So people have been taking it for such a long time, and it's in general being used both therapeutically and sort of at a supplement dose, as a preventative measure. So a lot of mushrooms, when you think about it, they really work on the immune system. That's really what they're about optimizing health. So if someone wants to optimize their health, it's certainly a thing that you want to be taking on a daily basis. I take them on a daily basis, and they're fantastic. They do all sorts of weird and wonderful things to your body.
Something I always wonder about, like there's some things in Chinese medicine that are, like you said, they're obviously identified very early on, but they weren't really used as a herb in formulas.
Mm-hmm.
And that's one of those things, right? That it wasn't really used in formulas. So do you think people were just going around taking it as a food at that time?
Yeah. And cook it, using something, it found its way into a lot of culinary things, or basically just taking as a single ingredient. So it's very typical that happens. Those some of the formulas are in some of the herbs, some of the mushroom, some of the funguses are in some formulas, but it's rarer than other herbs for sure. Yeah, it's really interesting looking back and trying to think, why aren't they used in these kind of, other forms? But I think just because they stood alone so strongly, I think that's why they sort of just looked at it like that.
Yeah, so maybe that's a thing that doesn't need necessarily to be in the combination of a formula altogether. It can, just like you said, be used as a standalone food.
Yeah, 100%. Yeah. So yeah, nowadays, there's so much research behind it as well, and they're usually researched in single mushrooms. So yeah, there's a lot of research behind it. It's very, very fascinating what we're finding nowadays. Yeah, but right. That's if you just totally disregarding the fact that they've been used empirically for thousands and thousands of years.
Yeah. So if that's not good enough for you, then you can get the.
Yeah, I mean, how many years do you need something to be effective, right? So
yeah. Okay, that's awesome. And so, what's roughly the difference between these different named mushrooms? Should people just take a variety of different ones? Should they take a bit of each one every day? Should they take one for a while and then stop and then have another one? Or
yeah, I mean, a good way of understanding herbs is by taking them over a course of time. You actually get to learn what the mushroom does, because you've got a sort of comparison. If you're taking one this day, one that day, a little bit of that, a little bit of that, it might just get confusing. If you really want to understand the herb to a deeper level, you do need to, basically fast on it. That's how a lot of these herbs were discovered. They were discovered by, aesthetics and in the monasteries. That's how they still do it today. They fast on particular substances and take them for a long period of time to feel what they do. I work with my teacher is a Buddhist monk, and I gave him some herbs recently for something. It was very hard to give him herbs, but he, because he's like, just use meditation. But he actually accepted some herbs from me a while back. And I was just amazed. He knew exactly where they were. Never studied these herbs before in his life, never thought, but he knew exactly where they went, what they did, what temperature they were, what parts of the body, what organs they were affecting, what part of the bloodstream. It was amazing. Wow. To listen to him talk about it, just because he's lived his life as a monk since he was 11 years old. He's in his 60s now, and he could completely tell you everything you needed to know about this herb. It was amazing. Even in formula as well, he would explain to me, and he said, this is what it does, this is what it's doing, right? And I was like, yeah, it's exactly what it does. Yeah. So wow. To answer your question, yeah, you can, to really learn that, you could do that. But if you're just interested in dabbling in them, yeah, just, try some. You can only know by trying. Yeah. Very safe. They're very safe, they're very safe herbs. So, yeah.
But it sounds like if people are interested in seeing what they do for their own body, they're better off just trying one thing at a time and see what that does for them. If everything's kind of the same in terms of their diet and their lifestyle and their whatever's going on in their body is kind of the same, and you're taking that, and then you'll know what that's doing. Like, if you feel your brain's functioning better, or you feel like you're more motivated, or whatever is happening.
Yeah.
Rather than
100%.
having a snack on each one, and then you don't know which one's doing what.
Well, exactly. And the reason, the way that mushrooms work, most of them work from an immune perspective, right? They usually treat long-term illness. So you can't expect them to work very quickly. So you have to take them slowly over a long period of time to see any benefits. And this is why when we make them, we make them into wands, which are like a honey pill. And so what that does, or honey pearl, we call them. So what it does is it acts like a slow release. So it's gentle on the stomach. When you take mushrooms, there's all sorts of compounds in there. We don't go into the science about it, but there's basically a lot of things that they basically need to be absorbed into the digestive system. They're just not quickly available to the human body, so they need to be processed. So when we use this method, it works like that over a long period of time, and it allows for a slow uptake into the bloodstream, and that's the efficacy. So although you may not need to take as much physically, the benefits, what's actually bioavailable, is substantially larger than what you actually need to ingest.
Yeah, and that's because of that method you have that you use to make the honey pearls, right?
Yeah, the administration method, exactly.
Okay. And with your honey pearls, how many would people take if they were just wanting to try it out and they were going to do it on that long-term basis? How many would they take a day, do you think?
The standard is about 9 a day, so three times a day, roughly.
Yep.
Yeah.
And it's better to take it regularly through the day than just have the whole amount at once,
Yeah,
right?
definitely, because mushrooms by nature, especially like any kind of mushroom, it's a bit, you don't never have a lot of mushrooms. Even your little button mushrooms, you never have a big bowl of mushrooms, right? You just take a little bit because otherwise they can get a bit gripey on the stomach, and that's because of the compounds in the mushrooms and their availability, their bioavailability. Yeah.
Yep. Yeah. So you're kind of trying to almost, if you sort of replicate how it would be in nature, you wouldn't just down a massive bowl of them.
No, you
would
just
get them
yeah.
a little bit.
Yeah.
Yeah. Yeah.
And they'd be
What
to find too, in nature. So you kind of replicating what would happen in nature. You would sometimes you do find big flushes of particular mushrooms, but typically it's small amounts, right? So you're kind of replicating that way.
Yeah. What I like about your packaging and stuff is those jars are great because you can just throw them into your handbag, or if you're a man, in your man bag, and they're just there, right? Or you can leave them in your car.
Yeah.
And they're just like, as in you just like, that's what I do. Or I just sometimes I keep it on my desk where I do my editing.
Yeah.
Because I'll be doing something. I'm like, oh, it's there. Okay. I'll have a few. And
Yeah.
they taste so yummy. They don't taste yucky or anything.
They taste nice. Yeah, that was one of the big things is you do need to make them taste nice because we use organic honey, a local organic honey, and that just helps to, it not only binds it, but it acts as a natural preservative. So it's got multiple uses, So natural preservative. It's actually therapeutic for you. It's it's locally sourced. It's organic, and you can, and it becomes a slow release as well. So it binds to the compounds of the medicinal, the mushroom or the herb or whatever it is, and then allows for that slow uptake into the small intestine rather than getting absorbed and broken apart into the stomach.
Yep. Yeah. And like, is your company's unique in making them like that, right? With the honey?
100%. Yeah.
Yeah. And because I don't think a lot of people really know until you've tried it, you won't realize like it looks like a little pill, but it's not. Like you squash it and you can just chew it up.
You just chew it.
They're not, it's not what you would maybe expect.
No.
Until you've tried it, right? And you just
exactly.
I'll just chew. Like I've given them to some patients, and even the other pills the pill things that you make for the other formulas. And if they've never had it before, it's very strange for people because they're like, they look at these little balls and they're like, oh, I'm supposed to swallow these down. I'm like, no, just chew them up. Like, because you don't find that no other companies are making anything like that. I mean, unless it's like a fruit and nut ball.
Yeah, exactly. Well, I mean, that's the sort of ethos of our company is really about reviving ancient traditions, right? So these traditions are being lost. Unfortunately, Chinese medicine is definitely becoming more and more diluted, even within the Chinese medicine industry, especially now within the Chinese medicine industry. There's all this dilution going on, all this, mix it with this, speak it with that, have different, integrated with this and integrated with that. It doesn't really speak to the authenticity of Chinese medicine. And it doesn't revere the history of Chinese medicine. So that's what we really, really need to do. We need to learn from these incredible people before us that knew so much about the environment, so much about how the human body works in that environment, and how to keep it healthy.
Yeah.
To make one an immortal.
Well, I'll take the immortality for sure.
Immortality.
I don't think people would want me around forever. I'd be sick of it after a while.
Of course we would.
You've been around for 400 years, Marie. It's time to go.
Yes.
It's so interesting. And I think what's interesting, like, it's something you just mentioned about that connection between the nature, right? And like in the old days, I guess obviously Han Dynasty, even later than that, people would have had to grow their own herbs and respect the environment. Otherwise, there wouldn't be any medicine for your patients, because where's that medicine going to come from? It doesn't just come from a factory. It doesn't just come from a supplier. Like, I'm grateful that I can just make an order when I need something. I don't have to like
Yeah.
see if it can grow or
Yeah.
go and hunt for it in the wild and do that. And like one thing that drew me to studying Chinese medicine when I was younger, because I didn't really know much about it, and I just had done it straight out of high school. And I used to watch a lot of those kung fu movies. And when I went to China, I seriously thought that's what it was going to be like. I just thought it was going to be like Wong Fei Hong and his
Yeah.
little crew, like making
Yeah.
herbs and stuff. But that got me interested in the Pao Zhe stuff of it, because like you see people who are herbalists had to do all of that work themselves.
Yeah.
And we don't have to do any of that work. And like
I still do.
yeah, you do it all for us, right?
Yeah.
And you're there
Seriously,
slaving over a hot grinder for everybody
and rolling, and we make all that stuff. Yeah.
And I think that's something that you I don't know, like even just, I mean, mixing up granules is still making up herbs, but it's not, it's even another step away from that. And then raw herbs is even another step away from the whole bit that of the growing and all that, and there's some practitioners that don't even do anything. They just grab a jar off the shelf and that's all that they do.
Yeah.
And it's, you're right.
Yeah,
there's lots of stuff that's being lost.
It is the I guess it's just the situation that we're in at the moment. It is a product of our time. But I think, just having reverence to that, like having reverence and having appreciation and at least attempting, someone's got to be doing it. I feel like, we've got to keep this alive. Things die. I've watched, my teacher that I just mentioned before, he's part of an ethnic minority in Burma who are really suffering from serious cultural genocide. I mean, it's nothing short of that. And I've seen his medicine and his language and his culture diminishing at a devastating rate. And I've seen, what he's got to pass on and what he's unable to pass on to his next generation. And it is truly devastating. The same thing happening in Australia as well, and in many cultures around the world. So, but I think that, if you can do a little bit of part to kind of preserve that, not with a feverish kind of obsession, but you do have to be obsessed, a little bit obsessed, but you know what I mean? Not with a righteousness or a sort of a fundamentalism about it, but I think with a passion and with a respect. I just find a lot of satisfaction in that anyway. Yeah,
it's good. And there's some people that are more more like their gift is more of teaching as well and showing others, and they're just very good at doing that. And the people that are able to do that should do that more and feel that there is a place for that. Like there's some practitioners I know who are very, very good and they just don't put themselves out there, and they should do that because they've got so much knowledge to give. And if they just unfortunately when they pass away, who will know that knowledge that they had?
There's so much experience, and like you said, from clinic to growing and all that way through. And I guess at some point you've got to decide where you're going to be in that chain, in that grand scheme of things. And that's the other beautiful thing about Chinese medicine, that it doesn't belong to anyone. A lot of people try to possess it and try to control it. It's just not. It's not about ownership. It's a shared thing. So is health and healing. So I think it's everyone does play a part in it, and it's a good thing. It's a good thing.
It's good. Just going back to the mushrooms, I think it's also a good way for people to get introduced to Chinese medicine that they might want to just do the self-help stuff. And they're like, I have a lot of people that contact me through the channel and stuff that are like, just I'm astounded by how much knowledge they have, and I'm like, wow, you're really invested in learning about how you can be more healthier. And this is one of the ways, I guess, if people are they're able to just use it by themselves without it needing to be prescribed by a practitioner. And
this last couple of years are even more true in that respect. So much isolation's happened. People have gone so much more internal and discovered things. People are innately do know that a lot of these things about themselves. They often, I'm sure a lot of people, I see so many people get so frustrated, like, I know what's wrong with me. You know, it's so funny, you know, I've always tell this story to my patients where you say, where the patient comes in, because they say, oh, you know, my doctor told me such and such. And you say, well, what did they tell you? And they give you some Latin word. And it's like, well, that Latin word just translated into the English word of what you just told them you had. For example, like my favorite is, you know, osteoarthritis. So you walk into so let me just understand this, you know, you walk into the doctor's clinic, and he said, my bones, my joints, where my bones are like inflamed and hurting. And they go, let me just think about that. Just a sec, Marie, just take that into respect. Hang on a second. Let me just do some tests. Yeah. I've got a diagnosis for you, osteoarthritis. And you go, oh, thank you so much. You know, we're fantastic. What would I do without you? And off you go with your medicine, right? And then you don't realize that osteo just means bone, arth just means to articulate the joint, and then itis is just a Latin word for inflammation. So you basically just said what they've told you that, yeah. So, yeah, not much use in that. Yeah.
Well, there's other utility that they have with that, but yeah, that you're exactly right. And I think people who are really aware of their body, they can then really use that as a way of when they take these different, like whether it be mushrooms or different other things, and you can really take note of, like, you know, and like you said, trust in what you said. You don't need someone else to observe that as well and qualify what you already know. Yeah, it's
a fine line, isn't it? And I think, you know, having the self-knowledge, but then also using, you know, your community and your and professionals in your area to give you the right advice. There's time and place for everything. It depends on what it is, of course. But yeah, I think there's a time and place. But yeah, it's definitely becoming harder and harder. And I've seen a lot of you know, practitioners, whereas they would have never, you know, diagnosed anything via telehealth, I just have to, because they've got a patient in front of them that's needing something, and they cannot physically get to that person. They cannot, you know, and so they have to adapt. The people who have adapted and tried new things have helped. And the people who have just gone, well, that's just not me, I can't do that, they haven't helped anyone. And there's people out there that are suffering that need that assistance. So it's incredible that we've had to adapt. So it's yeah, but it definitely is a fine line. You know, whether that's going to mean that people take all that responsibility and on themselves now more and more, or whether there's sort of a, you know, like, you know, things like your podcast, this is about informing as much as and just having this discussion that it's not, there is you and there is you know, there is the professional, and then there's the person. There's a subjective and objective perspective. And I think, you know, it's kind of balancing that out becomes very, very difficult at times. But it's important to always keep that in mind, that there is always someone out there to help you as well. Yeah,
that's right. And like, it could be almost like, I find with my patients, sometimes you become like a mentor to them, in terms of, after a while, like, no practitioner that I know wants to keep seeing people in their clinic all the time, because that means they're not getting better.
For sure.
And after a while, like, if you've helped a person to a certain extent, they might only need you every so often, and you're sort of guiding them more on lifestyle and diet things that they can do. And, you know, I really like that. I think, okay, that's good, because they're not needing you for treatments all the time.
And you've done your job in that respect. You really have done your job.
And that's something that, I mean, that's why people watch this channel, because they want to know the self-help stuff and also understand what their practitioners are telling them, have it explained in more detail, because, you know, we all know there's not much time in the consult to give people a lesson on Chinese medicine.
Oh gosh,
and people are really interested to know what does that mean when I've got dampness? What does it mean when you say I've got spleen qi deficiency, or whatever the thing is? And how can I try to help that myself? What are the things? So maybe we can talk about that. I'm not sure if there's anything you can say about the mushrooms and the different TCM patterns. Are there any mushrooms that are better for different patterns, like dampness or spleen qi deficiency or liver qi stagnation?
I mean, not really.
To put your TCM hat on for a second.
Yeah, it's hard, isn't it? Because you're not really. So when these herbs were talked about, they weren't talked about in that context, in the TCM, in the modern TCM context. So it's very hard to take those uses out of context. You're actually looking at it from a Taoist perspective, if anything. So that's a very different way, looking at it from a 5-element perspective. So, with the Ganoderma lingua that I mentioned earlier, the Reishi mushroom, that's a good example of that. So the 6 jurs, the 6 Ganodermas were exactly that. So they went around the 5-element chart. So the red one, all right, so the lingua, and then it went around to the yellow, and then to the white, and then to the black, and then to the green, and then to the purple, which was the split between fire, the 2 parts of the fire element. So, and we do, all those are associated with the different elements and with the different organs. And a while ago, I'm not sure if I've ever told you this story, but a number of years ago, probably about 12 years ago, I met a guy whose name's Todd Mansfield, and met him through his wife, who was a practitioner, Bo. She practices in and around the Byron Shire area, and he is a fantastic mycologist, so a person who studies mushrooms, and he found a spore print that we thought was the white Ganoderma, because I couldn't find the white Ganoderma. So we found all the other ones in the 5-element. I couldn't find this white Ganoderma. And then one day he said to me, I think it's actually got the name's been changed in the 1800s by this German mycologist. And he's done a lot of research, because I was saying this would be really interesting to find. And he said, he brought it, he said, I'm going to culture it. And he cultured it. He grew it in some grain spawn. And then he put it onto little plugs, which the mycelium grows around a plug, and you can put the plug inside a tree that inoculates the tree, and then the mushroom comes out of that.
Wow. Okay.
So he gave me the little plugs, and when I moved to my hometown in Port Macquarie, I planted them, put them in a hardwood log, and I left them there for a while. And I kind of thought, oh yeah, one day I'll check that. And it surrounded one of my garden beds, and then one day, sure enough, I went out to the garden. There's this giant, reishi looking mushroom, bright white on the top, white on the bottom. And I just thought, oh man, we've actually found this thing. So he identified the species. And I only told him about this about, a month ago. I saw him and I said to him, do you know this? And we were blown. It's a really cool story, because he actually found the lost Ganoderma, and we grew it. So it's pretty cool.
Yeah.
So yeah.
Wow. So
in terms of answering your question, yeah. So from a 5-element perspective, there are things that do that, but like I said, it's a different context. So you can look at it there's a lot of research, a lot of Western research, so a lot of scientific research based on those mushrooms. There's a great website called mushroomresearch.net. I can give you the link later to make sure you've got it for your people. I'll just double check. It's called Mushroom Research. And you can basically search by the mushroom, and you can search all the research articles for it. I'm sure you can search it the other way around, where you can search for issues you might have, and then look at the associated mushrooms that have got trials and studies. These are credible studies as well, I should say, that are associated with those mushrooms. Some really, really great research out there. I mean, Google Scholar is a great resource as well.
Yep. So people should probably just research for themselves if they're not sure which ones to use, based on what's wrong with them or what they'd like to help.
Yeah, it's very hard for us, obviously, to offer health advice, but yeah, they can do that.
Yeah, and they can find out what those mushrooms may or may not do for themselves.
Yeah, absolutely.
Yeah, awesome. So yeah, that's so great. And like with your sourcing for those products, is that the same kind of thing with your organic or your testing and all that sort of, like that quality? Is that the same that you have on the herbs for the mushrooms products?
100%. Yeah. So we have an organic. We set everything in terms of grading. So we grade everything from A grade, which is a conventionally grown thing, to AAA, which is completely pesticide free, and then organic, which is certified organic.
Mm.
So yeah, same policy, same process for our mushrooms. Mushrooms go through a little bit different processing through quarantine in Australia, but yeah, the growing is highly controlled on organic farms.
Yep.
Yeah, we're growing everything from chaga, cordyceps. We grow Cordyseps militaris, lion's mane. Lion's mane is pretty fantastic. Reishi, as I mentioned before, turkey tail, shiitake, and then we make a mushroom complex, which is a combination of all of those mushrooms. Yeah.
Okay, great. So if people are just that would be good if they did want to just have the benefits of lots of different ones, they could just get that complex one that you do. Where you put everything.
It's designed for that reason. Yep.
Yeah. Okay. Cool. Awesome. So interesting.
Mm-hmm.
It's so good that people can find out, because it's exploding all over the world, like this industry, isn't it? And it's been around in China a long time before, like as in obviously as a medicine and a thing, it's been around, but it's also been very popular as a superfoody kind of thing for like many years before it became popular in the West.
Absolutely, yeah. And that's why I think it's important that, especially when it comes to Chinese medicine, that Chinese medicine for practitioners are the people who are skilled in using those medicinals and prescribing them. So I think that's kind of why we took it upon ourselves to make sure we had the best quality of that source material, from the suppliers that we've trusted have been sourcing our good quality, and then using those traditional methods of administration. That's kind of what we try to employ as well, to make sure that people are getting the proper benefits, because there's a lot of various ways to administer it, but this is the way that is the most authentic to Chinese medicine.
Yep. Yeah, and it tastes good, and it's easy for people to do it like that.
And it tastes good. You don't have to mix it with your latte and ruin your latte, right?
Mushroom latte.
That's what someone said to me. She came up to me at a trade show. She tasted. She's like, "Are you kidding me? I don't have to ruin my latte. Thank you."
Oh, because people are selling those powders that they just say put into your coffee.
With your cup, you've got this beautiful cup of coffee, and like, no, have this. So it was pretty funny. I thought that was pretty cool. I said, no, you can just take that, and then I said, give me 10 bottles. So she was she was really happy.
Yeah, it's so good. Yeah. Cool. So do you have mushrooms just growing readily in Port Macquarie that you can?
We do. We saw some locally. Yeah, I'm always wild foraging. The season here is finished, pretty much finished up. But yeah, I was foraging pretty much every weekend, and then try to get out during the week as well to some of the local forests here. And I've got my little secret spots that I go, and I love it. It's just great. It's one of my favorite things to do. I take my kids. We take the kids and friends and families and kids, and we all go out. And I said, quick, come on, guys, go and get this. And we bring them back to the local market and sell them to the thing. And the kids get some pocket money. We pay for the lunch, and then we just have a great day out. We don't make any money. It's just for the experience.
Yeah.
It's a great process. And the kids learn as well. The kids learn what's safe, what isn't.
Yeah.
How to pick, how to be careful with something. They really respect it.
Yeah.
Something for everything, something for everyone. Yeah. Great.
Yeah. That's something I'm super interested in. I tried to find some. I just literally drove back from Albany today.
Oh, right.
Yeah, I was down there for a week, and I was staying with some friends. I said, what do you want to do? And I was like, I want to find some mushrooms.
Yeah, awesome.
I didn't find any. I just found one little tiny thing, and it was like all wilted. And I said, is this a mushroom? Does this count? And they were like, I don't think that gets anything.
No, wow. There's a great app for your listeners. Man, there's a great app. I'll just double check what it's called. It is the best mushroom app I've ever seen. So a lot of people have had problems with identification, right? That's one of the biggest scary things about mushrooms, right? So, mushrooms can be anything from super beneficial to super toxic, right? Yep. So an app has come out. It's called Picture Mushroom.
Oh, wow.
And it is unbelievable. You can just basically just links to your phone and a camera, and you take a photo. It says, hold the mushroom like this, hold the mushroom like that, and then it gives you a couple of possibilities, if not the only possibility. And it's very, very accurate. However, I say this with caution. You always should double check, triple check, talk to a local mycologist. Never eat anything out of the forest, of course. But this is a really, really, really good tool to start to learn and to research. And yeah, if you're like yourself, you're looking for something, you're not sure, it's a great way to at least start to think, well, is this possible? Is this not? And it's very, very good. I've never seen anything that good. So yeah, picture mushrooms. It's
awesome.
Very good.
Yeah.
Love it.
I think that would make the forest walk more enjoyable.
More enjoyable and educational. Yeah, absolutely. Yeah. Because you got to be careful even when you pick certain things. So bring a knife, bring a glove, like whatever, if you want to be super cautious. Most, wash it, don't grab a mushroom and put it to your face.
Yes.
Like you do have to be careful.
We should just say that again. Never eat a mushroom from the wild that you don't know.
Full disclaimer, don't do it. However, educate yourself and talk with those who know. Yeah, well, next time I'm in Albany or WA, well, I'll take you to the forest and go for a walk.
Great. You probably know where they are. Versus me just looking for them randomly.
I'll give you a hint. A lot of people look down when they're looking for mushrooms. I look up. If that gives you an indicator. Right. So you look up if you want to find a mushroom.
Okay. So they could be growing in the trees and out of the.
No. So most mycorrhizal, there's different types of mushrooms, but a lot of mushrooms have a symbiotic relationship with certain species of trees. So if you can find those trees, you can find the mushrooms. Okay. Yep. That's why I'm looking up. And then you look down.
Okay, right. Sorry, I thought you meant that would grow. That's how dumb I am.
No, some do. Chaga grows up there.
They grow with the fairies, right? Where the fairies in the trees.
No, some growers plonk, some growers, big. The saprophytic mushrooms grow like that on dead and decaying branches. But all places. Very interesting kingdom. Very interesting kingdom.
Well, they can save themselves the trouble and just buy them from you.
You can. Well, you can ask.
That's what I did. That's what I got on my trip from the store.
Let me do the work. Great. Thanks very much. Yeah.
Well, the local store in Denmark had these. So I got some on my trip.
Yeah, you were foraging, were you?
Yeah, in the hunting and gathering
health food store.
In the store. Yeah. Anyway. So good. Awesome. Thank you so much for sharing your expertise. And those websites are really good for people, and that app is awesome. So we'll put the links for those things below.
Yeah, I hope it helps.
And Simon's doing a special deal for people on this channel. Which is awesome. So we'll put the link to that below and the deal for that. So you can go onto their Empirical Health website and use the promo code that we'll put in there. And I'll put the details of that in there. So there's a little discount there, and that will get you started to kind of explore the range of different mushroom products that they have.
Yeah, totally. I hope it helps your listeners. And it's a great thing you're doing. It's really important to get this out there in the community. It's we need more mediums like this to communicate a good, safe, and beneficial Chinese medicine.
Yeah. And look, I like supporting people that are doing the good things for our industry, and I hope that your business does amazing and continues to do amazing because we need you, and we need, you're doing so much for people that don't even know you're doing it for them. I think about that every day. I think you're doing so much good for Chinese medicine that, it benefits people that are not even your customers and people that wouldn't know. You're just doing the right thing for our industry.
That's very kind of you to say. Thank you.
It's true. Yeah, so I really appreciate that. And
We appreciate the support.
if
Yeah.
practitioners are watching this, I would support Simon's company. Go and check it out, and you can inquire about becoming a customer. Like a if you're a practitioner, you can get access to the other herbs.
Absolutely, and you're a trusted supplier of ours.
Yeah.
So as we started, we were a lot of the public were looking for good quality herbs. They were looking for herbs that had been tested. They were looking for this. So we figured, wow, we better. Right, we don't, we couldn't manage all the people who wanted this. So we thought we better sort of honor the people that are supporting us, like yourself. And so we have a list of trusted suppliers that you're on that list. So on our website, you just trust a supplier, and you can search for people who are using good quality herbs that you can get good consultations from, that we trust as practitioners, that we sort of say, yeah, we trust these people and they're doing the right thing. So it's not that people are doing the wrong thing, but these are the people that are doing have got the same interests and same direction as us. So
yeah, it's cool. Well, I've posted your herbs all over the world. Actually, had a patient that contacted me through YouTube who's in India.
Yeah,
and I safely posted the herbs to India.
Yeah, right.
They got through the customs. I thought there wouldn't be a problem.
Yeah,
and they got held up, and I was like, oh, hang on a minute, hold up.
Yeah,
And but it got all through fine, and I've sent them to the UK, and so they've gone all over the world from my my business.
Yeah, that's awesome. Yeah,
and it was interesting because one of the people the patient that I had in India, she was very concerned about the quality of herbs, and she was like, oh, I know your herbs are good quality, can you post them? And she was willing to pay the shipping and everything to have them shipped from Australia, because she said, oh, I know you talk about I want your herbs. Like that's what she was saying to me, So
that's one of the things. Yeah, it's a big question. People often ask, how does the price compare or something like that? It's like, well, if I ask that you ask that question, would you have herbs that cost nothing and you couldn't guarantee the quality, or herbs that cost a little bit more and you could guarantee the quality? I mean, that's the difference. Would you give that to your child? Would you give that to your parents? Would you give that to yourself? And you wouldn't give it to your patient either.
Absolutely.
So
if the quality is good, you don't
so much better as well.
I find that the price is overall going to cost you less because you're going to get better quicker usually.
That's the other
That's
thing.
one reason. And you usually don't, even sometimes the dose might over time be less because the quality is better.
Yeah, absolutely.
So people are winning.
Yeah, and people who take herbal medicine are typically not that well. Like you said, you don't want to be taking herbal medicine all your life. You want to be taking them for the time that you need them, and then you want to move on and use diet and lifestyle, like the other things you said. So you don't want to sustain it any longer, and you don't want to make yourself sicker by taking pesticides and all the rest of the nasty things that are in the we've done testing for and found in herbs, which is why we test them. And then reject them if they don't pass the test. As simple as that, isn't it?
You're the John West of Chinese medicine.
John West.
The herbs John West rejects. Only the Australians will probably get that joke.
I think I will. That's like from the 80s, isn't it, as well? Like that's like imagine like a 90s ad, maybe. Yeah. People got to speak to the millennials now. They won't understand that.
Yeah. He's just good quality.
Yeah.
All right, awesome. We better stop talking, and we'll just keep making dumb jokes. No one will get.
Yeah.
Awesome. Thank you so much, Simon. And people can click the links below to find out more. And I'll see you again on another episode soon. Thank you.
Absolutely. Got any other questions? Yeah, shoot us an email. Give us a call. We're happy to help.
Awesome. Thanks.